Because I think healthcare is a much bigger issue than just what's going on in the hospitals. I feel it as a frontline member of the nursing force. I see every day the effects of cutbacks and everything, but the effects on social care, the kind of backgrounds that people are coming from now, everything is being affected by austerity. And, you need as many people as possible to get out there and say that, enough's enough, we can't carry on going like this. And also I think it's important to note as well that, the situation or the crisis has been so downplayed by the politicians, making out that actually it's not as bad as it is and that they've put more money in and all of this stuff. And, I challenge anyone to come and actually experience it on the front line and say that we're not struggling, we're not suffering.
So day to day, you are seeing the effects of underfunding and mismanagement. That's what we're talking about, really, isn't it?
Yeah, I started out as a student and I did my 3 years training, and as part of that you're on the wards for 50% of the degree. And the ward I work on now, it's heartbreaking really. As a newly qualified, I'm seeing the nurse in charge going home in tears every night. I'm seeing people go off on sick, on long-term sick, people saying that they've never worked in an environment like this before, always understaffed, constantly having people waiting. I walked past on New Year's Eve and the ambulances were queuing into the hospital. They couldn't even get into the A&E, and that is the effects of actually what's going on.
And so do you think, it's solvable though, isn't it? It's not beyond, it's a very important part of people's lives, the NHS. We can't give up, can we?
No, and I think anybody who remembers a time before the NHS will tell you how important it is. I've been lucky in that the NHS has always been there for me. I was born in the 80s and it was well established by then. But like anything, it needs money, it needs investment, and times change. It's not going to operate in the same way as it would have done 50 years ago. There needs to be more money, and there needs to be lots of changes with management as well in the way that it is organised. Privatisation is such a massive issue at the moment because I don't think a lot of people realise the full scale of how much things are being privatised, and once it goes that way you can never bring it back, and that's the downside as well.
So do you see the agency thing? We hear about that you get agency nurses coming in on much higher rates of pay and that sort of thing, just to plug holes.
Yeah, obviously the agency rates are a lot higher, and I suppose I sit on the fence a little bit about that, because although on the one hand I'd say we shouldn't be paying so much, actually the other thing that comes into it, which is bigger than the NHS, is the affordable housing or lack of. Because I'm under the impression that if you're working in London doing a job like anybody actually, not just people that do my job, but everybody should be able to afford a decent standard of living. And I can completely understand now, what with the cuts and the cap on wage increases and everything else, there are plenty of people working in cities like London who actually can't afford to rent or buy or anything like that on an NHS salary, and therefore probably are looking to other routes. But I think there needs to be a big look at where our money is going, how the budget is being spended, and actually some incentive to keep the people that work in the trusts working in the trusts, because everything is a battle. Every single thing is a struggle, whether it be the bursary to try and increase the pay cap. There feels like there's absolutely no support. It feels like there's very little recognition about what we do, and that's not just nurses, that's doctors, all the staff, And it just feels like we're constantly pushing uphill against resistance.
Fantastic. And so, what would you say to people? What should they be doing this weekend?
So the big message is to come out on Saturday for the demo, get your voice heard, bring your placards, get tweeting, get on Facebook, get on social media, come down to help out the PA for the next couple of days if you want to make some placards, spread the word, and just get involved at a smaller level as well. That so much of these things are at national levels, but wherever you are in the country, your NHS is being affected. So get down to your local hospital, see what you can do, spread the word, and get involved, because every voice matters.
Nice one, Helen. That's great. Thank you very much.
Thank you.